suffer well is what I tell people. And it's like, engage in this process and come out better. Come out with a little more wisdom, definitely with more resiliency, right? But you are not broken. There's a difference between pain and suffering. Pain is what the physical body experiences. Suffering is the story that we make about the pain. We don't have choice over that pain, right? Like that just is happening. We do have choice. We can make moves and shift around the story. And that's what I really want to encourage people to do.
Hello, everyone. I'm Dr. Jim Hoven, your host for the Ramos Law Difference Makers podcast. And every single week, we get to share with you someone who's making a difference in the lives of people, whether that's people close to you, people around the world. It could even be people making a difference in our world, which obviously has an effect on people. And today, I am so thrilled to present to you someone who I have become a huge fan of in just the last 90 minutes, because unlike any other guest I've ever had a chance to share time with and do one of these shows with, I'm with someone who I actually just got to listen to give a presentation on how to cope with stress, how to cope with depression, how to cope with grief. And as we know, mental health is such an important topic. We've talked about it before. And today I have Dr. Ron Schwenkler with me to make sure that we talk about that and bring this topic to light, especially in the context of trauma. And so, Dr. Ron, before we get started, I just want to tell you that last 90 minutes that I spent with you before we got to do this was so inspiring. I got so many gold nuggets from it. I wrote down a ton of notes. I know our team, you lectured to our whole team, both locally and virtually, and everyone wants to see more of you. I just want to thank you for what you do, number one, which we'll talk about more, but for being on the show. Thank you so much.
Absolutely. It's my pleasure being here. Thank you for having me.
Yes, sir. So today we're going to talk about trauma. And you, before we do that, I want to get a little bit into your background. Yep. You have and I'll let you go into this a little bit deeper, but the research I did from your website and kind of learning about you before you came in and shared with our team, you have a master's in counseling education, a master's in clinical psychology, and a doctorate in clinical psychology. In other words, you've put your time in. Tell me what kind of got you into that space of wanting to help people, their mental health, especially with trauma.
Yeah, I mean, it was purely on accident. I think I joke around with people, and this was not the plan. I did not, graduate with my undergraduate degree and wanted to get into mental health. And, I mentioned earlier, I just wanted to be a biker, but, I was looking for a job. And I started working with the younger adolescent, troubled teens population out in the wilderness, where I'd take teens out for 3 weeks at a time. And this was back in the 90s. And it just came naturally. There's certain parts of my childhood that, or it made it easier to relate to some of these kids and what they were dealing with. And it just kept growing, right? That's how it goes, right? Like, it's just, you get some encouragement, you get a promotion, you keep going, then it's like, oh, I'm going to get some formal education, and then more opportunities, come up. And it definitely was not the plan. I just seemed to be okay at it, and it just kept trying to get better and better with it.
So then you kept sharpening your skills, you're getting trained, and then all of a sudden you have not one, but two motorcycle accidents that lead you to really understand trauma from a whole different perspective, not only the physical, the recovery, but the mental and emotional and almost psychosocial portions of it.
So many layers, right? And so, in 2012, we moved from out east to Denver to go to DU, and my doctorate program was going to start in, about a month. And then I'm on my bicycle and I get hit by a truck going about 60 miles an hour from behind. And then a year later, I'm healing from all of that, did my first year of the doctorate program. And then a year later, I get hit by a kid on a crotch rocket that was going over 100 miles an hour from behind on I-25. And so in 18 months, I had 6 surgeries. Every 3 months, I had a new surgery while I'm starting my doc program, going to school, working practicums.
Have a family.
So I'm working on the side while I'm doing my practicum work. So at one point in my doctorate program, I had 5 placements, which I didn't tell them about because they don't want us working while you're getting a doctorate. Because, but it's survival, right?
Yes.
And so, yeah, I'm recovering from these surgeries, weird stuff with, getting having a new surgery every 3 months. It's like the anesthesia's messing with you, the concussions. I had a helmet on both times, but it, the brain gets rocked even with helmets. Like people don't realize. I mean, we know that from the football community, right? But the brain moves a lot, and it's made to move a lot. And life changes when it moves, too much, So yeah, it was just a wild ride over those many years just to recover.
Did that inspire you in some way to not only understand, but to want to do things in a very certain way when it comes to people who have been in car accidents or other kinds of injury situations because of your personal experience? When someone says, I have a headache or I'm disoriented or I'm agitated while driving, for when I was a chiropractor, I treated so many car accidents. It was unbelievable. And thankfully, I've never had those symptoms at a magnified level. You had to have a unique perspective. Did that drive you in some way to decide to take care of this type of person?
Yeah. I mean, the plan that wasn't the plan worked out perfectly, right? Because, many years later is when I started working with car crashes. And, so much of my personal experience has informed how I work with people and sit with people during these awful times of our lives. I mean, we just really don't know what it's like until we're in it, and we can know what it's like, but it just takes an extraordinary amount of empathy and, creative power to really sit in someone else's shoes. And the reality is most people just don't do that. So I was, unfortunate enough to get in these crashes and fortunate enough to get in these crashes that informed how I work with people. These little things, these change of life events that may only change life for 3 to 6 months, but it rocks people's worlds. And we just don't really understand what it's like to have a life-changing event like that until
it's a ripple effect, right? I've noticed, again, from the treatment side, it's not just you, it's your spouse, your relatives, your children, your workmates, your friends. So it ripples out, and they don't really know what my experience was in treating these folks. Sometimes those folks don't know how to give proper support. Yeah. Sometimes they don't know how to support at all, and they're judgmental. And why did my loved one change? So it goes all the way out into this, and there's a level of healing that has to emit around that whole group, right?
Definitely. Absolutely. So there's a lot of psychoeducation that needs to go into it. And so I bring family members in and let's just talk about the post-concussion experience, getting people to understand that trauma trauma symptoms are normal reactions to abnormal circumstances, right? Like when something bad happens, how should we feel? Bad. But then we get hit in the head and we feel worse because we can't process the badness that we could have previously. And so getting people on the same page, getting an understanding that this is normal stuff. This is what should happen when you get hit in the head that hard. And these are what it's going to take to recover. But it's not just the family members and the extended, not even work, but doctors, right? Like there's so many. I remember going through my, and I had great surgeons, I had great people, but so many times, these doctors are seeing people, the insurance, the culture of insurance just pushes these doctors to meet with more people than they really want to meet in their hearts, right?
Sure.
Like they gotta make their own living and pay back crazy student loans. So they're just meeting people like that, right? One after the other. So many times a well-intentioned doctor would say something, I'd just go home and cry. Now that level of tears is like, well, that's post-concussion, that's trauma, but just feeling helpless. Like, well, what is happening here? I don't understand what's happening. And that's when I've been in the mental health field at that point for 18, 17 years.
Wow.
And I still was like, what is going on? And so that's just my passion. It's just to help people understand that like medical doctors aren't neurologists. Like these guys are at the top of the food chain. And they're still if they just explain things an extra 5 minutes, but they can't. They're human. They make mistakes. They're being driven by insurance companies in their own practice. So that's kind of what I try and like pick up that job. It's like, I just want to be thorough with people and help people understand this is the course.
And so there needs to be education for providers as well. In having some of those conversations, they could use your services to hear about that too. What does a person who's been involved in an accident, whether they are snowboarding, slip and hit their head, they're hit, like you were on a bicycle and then a motorcycle, they were in a car crash. Does that fall under the bucket of PTSD on some of the stuff, or is a traumatic car crash different in some way? Are they the same thing?
No, they're not. And
Okay.
I think, each trauma specialist is going to look at this differently. And as I said in my lecture, I'm really particular about diagnosing PTSD. Like I think, I almost look at it as like, a sacred area, right? It's like it shouldn't be thrown around.
Yes.
And we got to, a lot of it's adjustment. So we just got to be careful with it, but it is different. Post-traumatic stress is different than post-traumatic stress disorder.
Okay.
And a lot of people with the proper intervention can work through the post-traumatic stress, go through the adjustment difficulty, orient and reorient to come out with what we call post-traumatic growth, right? Like that's the goal. Like the idea is suffering gives us a certain experience that births a certain type of wisdom that is really hard to get in any other way. And so I want to make people own that privilege of like, yes, suffer well is what I tell people. And it's like, engage in this process and come out better, come out with a little more wisdom, definitely with more resiliency, right? But you are not broken. There's a difference between pain and suffering. Pain is what the physical body experiences. Suffering is the story that we make about the pain. We don't have choice over that pain, right? Like that just is happening. We do have choice. We can make moves and shift around the story. And that's what I really want to encourage people to do.
That is fantastic.
Yeah, it's so powerful. It's really empowering, and it changes the pain, right? I mean, the studies are really clear on pain. When we accept the pain symptoms can go down. Not in everyone, but like, there's evidence that of this acceptance process. So if we can own the trauma, right, and suffer well through it and fight kind of that good fight, standing next to it. You can't deal with trauma unless you're holding hands with it, but doing it in a compassionately firm way, it's life-changing. I really, in some ways, of course, no one wants to get into trauma. I kind of wish, but like if someone said, listen, I can snap my fingers and you would never go through any of that process, first and second degree burns, the hospital, 6 surgeries in 18 months, a spine surgery 5 years later, I don't think I'd change it.
Wow.
Because what it taught me is
beyond description.
It's so special. It allowed me to be a better person.
Yes. And now that you're in the process of working with folks to heal from the physical, mental, and emotional traumas that occur in these types of situations, can you share what some of the symptoms are? If someone goes through an incident like this, again, car crash, slip and fall, something hits them on the head, I don't know, any number of things.
Life-changing.
Life-changing event, a trauma. Yeah. What would they feel physically, mentally, and emotionally?
Well, the physical part is probably the easiest part, right? There's going to be that pain, the aches, the lack of movement, range of motion goes down. And then there's some trickle effects of that, right? Because then they can't work the way they're used to working. They don't have the physical outlets. They can't walk. They can't walk the dog. It's just, they can't pick up their children. Right? Like that's a big deal for parents, especially new parents. Like there's all of these physical things that change life, at least for a time, which then has those emotional consequences, right? Like what does it mean about me as a father? And this happened to me, right? Like that motorcycle accident happened and I had a newborn. It's like I couldn't pick him up for a long time. And so what does that mean about me as a father? Like, I'm working hard and yet I can't console, a baby like I did with my other 3, right? So you start doubting yourself because you can't work like you used to, right? And then you have the physical aspect of the concussion where you're just not thinking as clear, right? So that affects confidence, right? That affects well-being, right? There's trouble finding words. There's trouble, staying organized, right? So there's all of these contexts that get affected from a trauma, right?
Yeah.
There's the classic, and people can look this up. There's kind of the classic symptoms. Kind of the post-traumatic stress symptoms:
the headache, lack of sleep,
lack of concentration, negative affect. Like kind of mood disruptions, avoidance mechanisms, where I need to do this thing, but I'm not going to do it because it's too scary. I don't want to think about it. Intrusive thoughts, right? So thoughts or dreams. Flashbacks can happen. There's, those classic symptoms. And that's easily, you guys can look that up. But it's the effect of that. That's kind of almost like the easy part is like, Here are the symptoms. It's a checklist, literally, right? And you can rate it, come up with a score at the end of it. But it's like, how does that manifest? How does it come alive? And then what does that do with our functionality? And that's what people wrestle with so much.
And you brought something up in the presentation that you did for us that really I hadn't thought about in a while. And it hit me before, like when I was doing rehab back in the day with some of my patients, if they injured their knee in a certain position, as a chiropractor, I did a lot of my work with someone lying on their back or lying on their stomach, adjust their spine, do their muscle work, tape their body, whatever. And then I learned one day that if they injured their knee in an extension movement, whatever that might be, then trying to rehab it or tape it or stimulate it in that extension move was something that we could consider because the nervous system was put in a similar situation. Mm-hmm. And when you were talking with us, you shared that in your own life that you were processing how you were feeling one way. And then all of a sudden, when you put your hands in a position that mimicked where you were on your motorcycle with your hands up above your ears and you were grabbing onto the handlebars, once you got in that position, it took the nervous system back to a point in time where, ooh, that's different. And so you didn't respond the same mentally and emotionally as you were with your hands down. Yeah. Can you speak a little bit to the triggers that bring this trauma back to life, even if it's weeks or months after?
Yeah, it's just, there's a lot of writers, Peter Levine, Bessel van der Kolk, Fisher is another one. But there are these modalities, these intervention modalities in psychology that the idea is the body bears the burden or the body keeps the score, right? And so there are certain reference points, it seems, that the body tracks. And so if we get hit by a car and we, kind of make this whiplashing back and forth, coup, counter coup, sort of, forward, backward, side to side, then our body tracks that. And there's a good reason, it seems, to track that, right? Because it was scary, it was random. We may have thought about death. And so from a survival potential point of view, we want to catalog that movement because it was life-threatening. And we want to know what to do next time when we move like that. So that makes sense kind of from, a cataloging or an evolutionary psychology point of view. But also, it seems like that movement then holds memories. Right, so we can be talking about the car crash and what that was like, and just purely the psychological parts. And sometimes I'll say, notice what it was like to remember moving back and forth, and it was that violent. Was what was that like? And then another wave of emotion comes because it's like they get to remember another aspect of the details that maybe they weren't remembering just by telling me the story.
Got it.
And I think it's really important that we understand that is also mixed with what I call resourcing, right? That, I was trained in a model called comprehensive resourcing model. So I will often, it's one thing just to ask a person that can be really disruptive because they start remembering things that are just scaring the heck out of them.
Yeah.
So I'll incorporate breathing exercises, grounding exercises, visualization exercises. So it's dual processing. So there's something good happening to the body, which is like a breathing exercise, while we are remembering what needs to be remembered so we can heal the way that we need to heal. And that, when we have that happening, it's almost like have you heard of the term cognitive dissonance?
Yes.
Where we have like two opposing thoughts and it's almost disorienting. I look at it like somatic dissonance, where we have two opposing feelings happening in the context of a trauma memory, right? One's resourced, and one is the trauma memory, and the body gets to kind of work through that. And people start to reorient around
That's
it.
Good. Is that anything akin to what Tony Robbins talks about in his neuroassociative conditioning stuff, where he pictures visualizing a thought and visualizing scratching a record and scratching a record and scratching a record, so that you're not playing over the same memory, if you will, or the same tract. Again, it just keeps scratching, and then you replace it with a better thought. You're doing them simultaneously it almost seems pattern interrupt or stop the momentum of the negative thing and try to replace that in a way. Does that?
Yeah, I mean, it sounds familiar with what you just talked about. I haven't heard about Tony Robbins, so I don't know, but that almost sounds like something called neuro-linguistic programming.
Yeah, NLP,
right?
exactly.
NLP,
yeah,
right?
It's a division of...
So that sounds cool. But I think what I'm referring to is more... So there's two types of safety, we could say, right? So there's cognitive safety, where I say, I'm safe, I'm safe, I'm safe. And as we talked about in the lecture, like the mind is really new compared to how old the nervous system is.
Yes.
So the mind can say, I'm safe, and the body's going, nope, not safe, right? So we have cognitive safety, and then we have physiological safety, which is more a biological base, where the body in the moment actually feels physiologically safe. And that's what resourcing is trying to invoke.
Got it.
Is this very deep feeling of being in the moment, secure, right? Connected in a familiar setting, or using familiar imagery, right? Special imagery. And so, it can take anywhere from 5 to 10 or 15 minutes to set that sort of imagery up with the breathing technique. So you're scaffolding resources in the body to let them feel physiological experience of safety. And then we bring in the thoughts, the memory of the unsafe, the trauma. If the body is secure in the moment, then it can process the trauma differently. If we don't set up the resourcing and you just activate the trauma, then when the trauma gets activated, the body, starts what's called abreacting.
Follows along.
It follows along, and it can often lead to abreaction, where it's like the body is now playing out the experience, and that can be harmful.
Absolutely. You had mentioned also, fascinating to me, and we all know this, but when you think about how it ties specifically clinically to your work, a person who's had a tough childhood that didn't get they were isolated, maybe they didn't get the love and attention. You used examples of rabbits and all these other things on how attention and intention make a big difference in outcome of how people process trauma later. If someone goes through a physical trauma like this, but they were raised in one was raised in a loving home with all kinds of support systems and all kinds of everything you would want in growing up, and another person who experiences the same trauma, physiologically, if they are basically equal at baseline, and they didn't enjoy that same advantage of being well taken care of and well loved and well nurtured, do those two potentially respond different 10, 20, 30 years later to the same car accident, slip and fall?
It seems, there's very strong evidence, and this is where like the resiliency studies, Dr. Bruce Perry, he's amazing to talk about this sort of thing, reading his books, The Boy Who Was Raised as a Dog and What Happened to You, which is his most recent book. It just talks about how, these early childhood experiences help build resiliency or vulnerability to, traumatic events. And it's not deterministic. It doesn't mean that if a person didn't have certain nurturing experiences, then they will definitely not be resilient. It's not cause and effect like that, but there seems to be there's trends, strong trends. And this was especially identified through the ACEs study, the Adverse Childhood Experience study, where when children are exposed to stressful events earlier in life, it affects them in other areas later in life. So like I said, it's not cause and effect, right?
Right.
It's not deterministic like that, but there are strong themes that seem to be playing out.
And of course, if we just now move that from the past into the present, I would imagine if someone is experiencing, if they're let's just say they're making less than ideal choices, whether they're not getting enough sleep, they don't get enough exercise, they're not in a healthy relationship, they don't spend time meditating, they're set up for a complicated healing process physically, mentally, and emotionally if they go through a trauma. I mean, that would be my assumption. Is that accurate?
I think so. I mean, and it's not just that they're not doing the good stuff, but they're also frantically trying to take care of the bad stuff that's happening, right?
Ooh, good point.
I just worked with a, he's got a bulging disc from a car crash, rear end, it's a fender bender, right? Well, he's a concrete worker. So a bulging disc in the lumbar region is a big deal. It's huge, and he's got a young family, and it's just like, so it's just really hard to sometimes justify for a person, well, I'm going to meditate or do some stretching when they're just trying to survive the familial and social consequences, the work consequences of this accident that they didn't cause.
Yeah,
someone else broke the rules.
Right.
And now their life has changed.
And and if they don't have those things set before the crash, they don't have the tools. They're not equipped with the same tools that someone else who had a stronger muscular system, a stronger emotional EQ, maybe a stronger resiliency factor. If they weren't doing anything before, then they're set up. And I think that really goes for kind of, as we talk about treatment of these things, the best time to take care of yourself is before an accident, right? Before a trauma, mental, emotional, or physical. So what kind of things would you give as a baseline that people should do? And you shared those with our team, because our team deals with so much stress of talking with people who, for some of these folks, it's the worst moment of their lives. What are some of the baseline things that people can do to stay healthy at every level, physically, mentally, emotionally, spiritually?
Yeah, it's just, it comes back to, I think what so many people are talking about, right? Like solid exercise,
like 150 minutes a week of
20 to 40 minutes a day, just walking, right?
Yep.
Like we're made to walk, so much. Some people say 20 miles a day, we're made to walk. It's like, just walk. I mean, that was the number one, thing I did for about a year and a half, right? And I like working out. I like pushing weight around, got a history of rolling and stuff like that. And it's just like, just walking helps people heal, right? So, being physically active, eating the right amount of foods, little things, right? Like just take out soda. Just don't eat French fries. When you have a hamburger, just eat one of the buns. Yeah. But, just put a piece of lettuce on top and have the lower bun. These little adjustments can make a big deal if we're done consistently. Yes. Right. So Zen is the idea of water dripping on a rock, right? The rock isn't going to change one drip at a time, but it changes because of the consistency of that little drip. So these sorts of things are really important if done in a consistent way. Yeah. Good sleep. Sleep hygiene is just an incredible thing that we're learning so much about, right? So no caffeine after latest 4 o'clock. I encourage people to stop drinking caffeine at 2, right? Just get the caffeine out of your system so when the sun starts setting, melatonin's getting released, we can just get in that natural rhythm of falling asleep. Don't look at your cell phones or put on night shift. That blue light out of cell phones keeps people up, a lot of restless sleep. Find peace at the end of the day. Right. With a journal or a gratitude or what right today, owning your wins, as you say. Yeah. Owning wins, I think, is so important. We have this biological negative bias where we pay more attention to bad things than good things. It's a nervous system level thing, and it's a force in our lives, and it's been keeping people alive for a long, long time, keeping animals alive for a long, long time. But we got to counter that negative bias, and one way to do that is just to own your wins. There's productive things. Even if you were in pain, you still got stuff done, right? Yeah. And if you're not in pain and if you are in pain and you're getting depressed and it's hard to get stuff done, right? And then celebrate it. Right, and then just own it. Yeah. One of the biggest myths in Western culture is I have to feel a certain way in order to do a certain thing. It ruins people. Emotions have nothing to do with going on a walk, doing the dishes, working out, hugging a child. Just do it and then notice how you feel later. Right. You don't have to be in a certain mood to do the good thing. Do the good thing and notice the feeling that comes as a consequence. Yes. Right? I agree with that. And I know I've heard from, and I'm not deeply educated in the Buddhist traditions, but I've
seen one of their axioms as being, if you want to alleviate your own suffering, alleviate the suffering of someone else. Like you said, give a child a hug, help someone who's hurting, call a friend who's struggling, and that alleviates our struggle. And I think that could take place whether it's in a pre-game, so to speak, a pre-traumatic event when we're prepping to be strong and be resilient, or after. I mean, I've had some times in the last couple of years where I've been hurting emotionally. And the thing that made me feel the best is when I could help someone else who was hurting.
That's right. Yeah. I mean, it's just a plan. The most basic of plans was taught to me by a veteran. And it's just, I went to his house for a weekend to do a workshop, and I was able to stay with him. And he had a whiteboard, and there were some lines written in permanent marker. And then every day I saw him at the end of the day sit down, there's a cup of tea, and he wrote with dry erase. So I'm like, what's he doing? I saw it for like 3 days in a row. Yeah. And so the permanent marker, I said, what are you doing, Randy? And he's like, well, this is it. And 3 things: help one person, learn one thing, do 3 things. And every single night he wrote, who'd he help? Right? And it was often more than one person. What did he learn? He wrote it on the whiteboard. What did he do? And he's an ex-operator, so he's doing all sorts of stuff every day, right? But it was just so simple. And I've told that to probably hundreds of people. Stick to the plan. Learn one thing, help one person, do 3 things. We can be broken physically and still carry out that plan. So that's a good thing to do. You know, as far as optimizing, like, what do we want to do? Going back to your question, what do we want to do before we get hurt, before the tragedy befalls us? Well, that's a good thing to do, right? So we got proper workout, good mammal interaction, right? Like help one person, do 3 things, learn one thing, good sleep.
What do you think about, you and I are both big fans of Andrew Huberman, and he's so big, and I've been since I heard it from him, I've been doing it religiously, is the morning light, getting sunlight in your eyes at least 5 to 10 minutes in the morning, depending on how cloudy it is and where you live and all that, as that setting your dopamine right, setting your clock to start winding down after about 16 hours. Are you a big fan of getting AM light as well?
I would be a bigger fan if I can actually do it, but I'm usually waking up way too early, and then I go right into kind of the home
into
gym
your day.
And but I mean the science is there, right? So his lab is unbelievable, and he's pointing out this good thing. So do it, right? Like do the things that you're learning about. But as we were talking in our lecture, we have such a tendency to pay more attention to the external world than our internal world. Right? And we have to attend to these good things like Dr. Huberman is saying and other people are saying, but it takes discipline, right? Because you have to have an extra piece of discipline to take care of the mind.
Yes.
We know it's there, but it's unseen.
Yes.
And when we have a broken elbow, we'll put a sling on, no problem, right? It's there, it's observable. But this other stuff's invisible, right? And it's elusive, right? And then I describe the mind using those 5 words, right? Brilliant, beautiful, treacherous, silly, and stupid. Like that's our minds. That's what we're up against, right? And sometimes I've experienced those things in like 3 seconds, all 5 of them at once. I'm just like, wow, right? And I think most people can relate to that. Like we work for ourselves and against ourselves. So making a move like you just talked about early morning, like what do you have to lose?
Yeah.
Just sit there, sit outside, take a breath, notice the day.
Yeah, so good.
Own the wins from the day before, right? Set up some plans. Remember
that's
the plan.
so good.
Yeah.
Now let's say someone gets in a incident, a crash, a fall, something like that. Is time of the essence when it comes to getting treatment? When should treatment, from my perspective as a chiropractor on the joint and the soft tissue mechanics, absolutely. You need to get taken care of sooner rather than later to get the best outcome. What about on the mental and emotional side? Is there a time where you better look to try to get into this thing as soon as possible, or do you let it go for a while and see how it responds on its own, given all the natural tools? What do you think about that?
Well, I think there's 2 layers to that, right? When we're talking about car crashes, it's the psychological and then the physical, right? The physical is the concussion. So I think we are much better at diagnosing concussions than we are at treating them. Like,
yes,
what are we going to do with treatment? Like, really? Like, well, there's this old saying, right? Like time heals all wounds. I don't believe it.
Not
right?
all.
Like, right. So when it comes to psychology, time does not heal all wounds. It does seem to have a pretty good effect with concussions, right? Like, but we can optimize it, right? So like if, people say I'm stressed, what does that mean? It means I'm experiencing something in this life and I notice it as stress because of the messaging that's happening throughout my nervous system in my brain, which is then releasing stress hormones. And then all of that happens in several seconds. And then I can say I'm stressed, right? But the messaging happens first. And then what are those stress hormones really? Well, stress hormones are inflammatory. So, while we're dealing with all this change of life, we're all this stress, and we have all these inflammatory markers spinning through our body, and that could be slowing down concussions, right? So it's not just time, right?
Yes.
But we want to spend time wisely, which is, can I reduce my hold, my grip on the change of life? Can I be patient? Can I help one person learn one thing, do three things? Can I fake it till I make it a little bit? Can I limp along holding my life together and trying to take as much space from the anxiety as possible to lower that stress hormones?
When do people do that? When do they say, I don't have the tools that I need, I'm not making the progress that I want, and they talk to someone like you? Because again, as a chiropractor, I could only give them the surface of the information of what they could do at home and how I could help them and support them, maybe what their family could do. But at some point in time, it makes sense to me that they want to either be referred or reach out to someone who's a specialist like you. At what point is that? Is that early in the game? Is that when they realize they're in over their head or their provider does?
I think earlier the better,
Yeah.
right? So we don't form bad habits, right? So within the first several weeks is optimal. That's what I think.
Get a jump on it.
Concussions take time, right? And we can optimize that recovery experiencing by reducing stress. We could talk about that if you want, but yes, we want to understand that trauma symptoms, like I said earlier, normal reactions to abnormal circumstances. And the quicker people can get on that and say, okay, like this doesn't feel good, but it's still normal, then they can adjust better, hopefully, as they move through the process.
And that stress, like you talked about, comes in different forms.
Yeah.
It's the stress of pain and I can't move. It's the stress of I'm missing work. How am I going to pay my bills? It's the stress of I can't pick up my kid. I can't go see their games. I can't have sex with my partner, whatever. All these stress comes in different ways. So we've talked about a lot of things that we'll call it the pre-event. If they're used to that, they can use those same tools in a post-event world to help navigate and mitigate that while they then look for help. Are there any other kind of tools that we haven't talked about that they could use to go through this process, or that they could be supported with? I know we hit a pretty wide variety already.
I'm a little sometimes unorthodox. I tell most of my patients, I want you to listen to a comedian 3 times a week for like 20 minutes. Like, because we get so locked up in ourselves, right? And so we don't realize that when we laugh, we're reducing, or we are releasing hormones too. Like, we're always releasing hormones and neurotransmitters. And so if we laugh, and the world is wild right now. Comedians are talking about some really funny stuff, right? Like it's funny.
Yeah.
Just three times a week, laugh. Like, get your body remembering, not just like there are funny things, but also what that does is it releases almost the exact opposite hormones that stress is releasing, right? And then, holding hands, right? Having intimate, special moments, with a loved one, right? That we're mammals, right? We're releasing oxytocin and prolactin. Like these are the exact opposite than stress hormones, right? So this optimizes the recovery experience when we realize like there's still good, there's still a lot of life to be lived, there's still laughter to be had, and my neck hurts like hell.
Yes.
But right, so it's not an either or.
Right.
There's still life to be lived, and my neck hurts still. So okay, well, but we're still doing some good stuff. That's
beautiful.
Kind of the mentality, the resiliency-based mentality that I push people towards.
I love that so much, and it brings me to a question that is going to be probably unorthodox for you, but I think it's one that needs to be asked in certain situations. And the situation would be someone was injured. It wasn't their fault. Like you said, both of your accidents weren't your fault. You were hit from behind and, and it caused a lot of problems. One of the things that we do as a personal injury law firm is we try to take the place of that person. We want to be their advocate, their champion, to do the heavy lifting so they can focus on the healing side and the things that we've been talking about. Have you noticed anything in your many, 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 many years as a clinician where the legal system, if you will, from the perspective of an attorney helping someone, has made that journey easier for them if it's done well? Obviously, it can be done poorly and create more havoc. But if it's done well, do you see where that can be a benefit in this person's recovery?
Totally. Yeah, absolutely. Right. Because, we're mammals before humans. Right. So we have all this circuitry around connection. Right. So we're tribe oriented, pack oriented, herd oriented. So when we have a specialist that's saying, well, I haven't been through what you've been through, but I'm feeling it. Like you've described it well. I hear you. Here is the plan. I am going to be responsive to you when you call with a stress, right? Like my lawyer was great. I would text, he said, and I didn't abuse it, right? Like it's just when my back was against the wall and I didn't know what was going on, I just said, man, I need some clarity here. My optics are wrong. Like, let me check it out. And he would just respond. And like, it was like someone was just holding my hand. It's like, okay, I got you. This is what we're going to do. It's like, okay, I just need someone to tell me that the direction is still going in the original plan. So it completely helps, right? It completely helps to know that we are not alone. Aloneness, like remember what we talked about earlier, that our nervous system has a couple allergies. Being alone is one of them. We do not like being alone. And when we're in a car crash, we can have our loved one next to us in the crash. But if the idea of death was present because it was just so random and so severe, in that moment, people feel alone, right? And so it's like, it's nerve-wracking to feel alone. And when you got providers like Ramos Law, like being able to be like, hey, we're here. This is how we're going to respond to you. This is the plan. It soothes people greatly.
That's so good to hear.
And then encourage. Right. We got to say, hey, listen, you can do this though. Like, yes, this is hard. There's no doubt about it. And I need you to keep doing what you can do.
So give them some responsibility and accountability.
Yeah. We don't, that's what I do.
That's so incredible.
Because we're stronger than we think we are.
Yes.
We are so much stronger. And unfortunately, it's hard to come by that strength unless you're tested. And these car crashes are huge tests, and people don't really know how to do it. And we have our culture that sometimes perpetuates a certain mindset of helplessness. And it's like, nope, we got to keep doing this. And this is what we're going to do together. And this is what our firm is going to do for you.
Wow. Right? That just warmed my heart up, my friend. I love that so much. I have one more question for you, and it's completely off base of any of this, and it's something that I loved to ask from people, and I'm particularly intrigued by asking you this question because of your training. If there's one piece of advice that you've learned along the way or that you've been given that has helped form the fundamental fabric of your life that you enjoy and that you're building and that you're creating today, what would that piece of advice be? Something that you'd like to share?
That's huge. The first thing that came to me, it's not so much advice, but it's kind of part of what I try and teach people. It's, work hard to suffer well. Like
work hard to suffer well.
Yeah, we got to keep moving. We got to, move our bodies, move our minds, learn things, engage with people. And life is hard. And we have to learn how to suffer well until the recovery is made. And sometimes it's hard to know, like, when am I recovered? It's subtle, it's incremental. But we got to be able to take a step back every day and own those wins and be able to see, like, well, I can't see what happened today, but like if I contrast and compare what's happening today with 2 months ago, I can see the progress. I'm owning that. That's suffering well. Keeping that hope, right? I might not be the same person, right? I'm going to try and be better, but I can still hold my kid's hand and give loved ones a hug, and reach out to someone and say, hey, I'm thinking of you, right? Like it's like kind of being graceful with the suffering.
Oh, man, thank you for sharing
that's part
that.
of it. Yeah, I mean, it's just hard.
Yeah.
Going through traumas is just hard, and it should be hard.
Yep.
And got to remember, our ancestors went through a lot, and you and I are talking right now because of what our ancestors did for thousands of years. They went through a lot of hard times, and if they can do it, we can do it. Right?
Whoa, I love that so much. Yeah. So if people want to get a hold of you, Dr. Ron, how do they do that? How do they reach out to you, whether they have questions or whether they've been through something like this, or they know someone and they want to receive your expertise or a consultation or something? How can they reach you?
My clinic is Mind Spa in in Greenwood Village, right, Denver Tech Center, and then I'm a contractor at Synergy
Health
Partners.
Yeah, we love those guys. They're great.
Yeah, good. So I mean, just look up Mind Spa, Google Ron Schwenkler. You'll find some stuff, and just keep trying to get a hold of me.
Nice.
I have a personal website that I haven't looked at in years, so I think there's like a contact form, and that's ronschwenkler.com. But Mind Spa is the current project that we just set up a year ago, and we're working on it, and we're trying hard to keep it going and grow it. So
I know you're going to do well, my friend. Yeah. Well, just know I couldn't have appreciated any more the time that you've spent with me. Yeah. It's been joy. It's been impactful. And I'm sure for those of you watching or listening to this, I know you got something from it. Please share this with someone, because we've all gone through trauma. Even if you didn't fall under the category of a physical trauma like we were primarily focused on, you've gone through something. So share this, send it. And if you have questions on other topics you'd like to talk about on the mental health scene, Dr. Ron has agreed to come back and do these with us again. Just send it my way. My email address is Jim, Jim at ramoslaw.com, RAMOSLAW, Jim at ramoslaw.com. And we will get him back for another episode. So Dr. Ron, until next time, thank you. This was an absolute joy for me. You are a rock star.
Thank you for having me. This is great, Jim. Really, really appreciate what you are, who you are, what you guys are doing here. Let's just keep up the good work.
Yes, sir, my friend. We got it. Cool. So until next time, everyone, get out there and remember, you too can make a difference.